Some people, taking aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs like ibuprofen or naproxen, can trigger severe asthma attacks, nasal congestion, and sinus inflammation. This condition is known as aspirin-exacerbated respiratory disease, AERD, also known as Samter's triad. If you've experienced breathing issues after taking NSAIDs, understanding AERD can help you manage symptoms and avoid complications. What is AERD? AERD is a chronic inflammatory condition involving asthma with symptoms often difficult and out of control. Nasal polyps, growths in the sinuses leading to congestion and loss of smell. NSAID sensitivity, respiratory symptoms triggered by aspirin or NSAIDs. Symptoms of AERD. AERD symptoms usually appear 30 minutes to 3 hours after taking NSAIDs and may include severe nasal congestion and sinus pressure, wheezing, shortness of breath, and asthma attacks, runny nose and sneezing, loss of smell and taste, and facial pain from chronic sinus inflammation. How does AERD develop? Unlike traditional drug allergies, AERD is not caused by IgE antibodies. Instead, NSAIDs trigger an imbalance in inflammatory chemicals called leukotrienes, leading to severe respiratory inflammation. Diagnosing AERD is often misdiagnosed as uncontrolled asthma or chronic sinusitis. A specialist may recommend medical history review, checking for a pattern of asthma, nasal polyps, and NSAID reactions. Aspirin challenge test, a supervised test where small doses of aspirin are given to confirm sensitivity. Lung function tests to assess asthma severity. Sinus CT scan to evaluate nasal polyps and inflammation. Treatment options for AERD. 1. Avoid NSAIDs, but not all pain relievers. Tylenol or acetaminophen is generally safe for pain relief. COX-2 inhibitors like Celebrex or celecoxib may be tolerated in some cases. Medications to control symptoms include leukotriene inhibitors like montelukast, Singulair, or Xyluton, which help reduce inflammation. Nasal steroid sprays such as fluticasone and mometasone shrink polyps and improve congestion. Biologics like Dupixent, Xolair, Nucala, Fasenra can reduce asthma severity and nasal polyps. Aspirin desensitization for some patients, which is a supervised procedure in which patients take gradually increasing doses of aspirin. Once desensitized, patients take a daily aspirin dose to maintain their tolerance. This helps reduce nasal polyp regrowth and improve aspirin control. Sinus surgery, if needed, which removes nasal polyps to improve breathing. It's often combined with aspirin desensitization or biologic therapy to prevent regrowth. Facts of NSAIDs and AERD. Can I develop AERD later in life? Yes. AERD typically appears in adulthood, ages 20 to 50, even in people who previously tolerated NSAIDs. Can antihistamines help with AERD? No, because AERD is not IgE-mediated allergy. Antihistamines do not address the underlying inflammation. Will my asthma get better if I avoid NSAIDs? Avoiding NSAIDs prevents flare-ups, but managing inflammation with medication or aspirin desensitization is key for long-term control. If you have asthma, nasal polyps, and NSAID sensitivity, you may have AERD. Avoiding NSAIDs isn't always enough. Targeted treatments like leukotriene inhibitors, biologics, or aspirin desensitization can help improve symptoms and quality of life. Talk to an allergist about the best treatment options for you. What are you waiting for? If you or your child need help controlling allergies, or you think you might need testing or treatment, or you might be a good candidate for allergy shots, Dr. Wendt and her staff at Relieve Allergy Asthma and Hives would love to help. Call for testing and treatment today. 480-500-1902 or request an appointment at relieveallergyaz.com. Learn more about Dr. Went and Relieve Allergy, Asthma, and Hives at relieveallergyaz.com or connect with us on Facebook, X, YouTube, or LinkedIn. Dr. Went wrote the book on allergies. Buy it now. Relieve Allergy, Asthma, and Hives is located near Kierland Commons at 21803 North Scottsdale Road, Suite 200, and has convenient evening and morning hours, as well as televisits to accommodate your schedule.